Okay, so in a previous video, we discussed why you may need to come off of TRT. In this video, we're going to discuss how you would come off of TRT. Find out next.
So welcome back to another episode of Balance Our Hormones. I'm Mike, and we're here with Sam today. Finally, we're together.
Yeah, in lockdown, yeah.
So we haven't done one together in a while, so it's good to go over some new topics. And one of those topics has come up lately. I did a video with Dr. George about why you'd come off of TRT. Why would you need to come off TRT? So like I said earlier, it's good to find out how would you do it? What's the best way to come off of TRT if you need it? So
yeah, it's quite a big anxiety. Like some guys, although they may be destined for it and they're really keen to get onto TRT, they have an anxiety of like, what's my get out strategy? If I did need to for whatever reason, and usually the reason is outside of their control, for example. So they want to know what would I have to do, right? So I think people go on to TRT and they're treated because they're trying to relieve their symptoms. So a doctor will be assessing them, treating them, and if they're a candidate to try TRT, then the doctor will go forwards with that with you. And the main thing to remember is that you don't have to be on TRT forever, but you do have to be on it if you want to maintain those same levels of testosterone. It's the same with a diabetic. They don't have to take their insulin, right? But if they want the control and the effects that the insulin provides, then they need to stay on that insulin. And obviously it can have health consequences in both areas, TRT and insulin use, for example, in diabetics. But the people hear that your system gets suppressed when you're on TRT, which is true. So the signal from the brain, in a really simple terms, from your brain that would tell your testicles to make testosterone and sperm, because the brain has detected a better level of hormones in the body, it basically suppresses that. So most people, when they have blood tests and they're on TRT alone, they will see suppressed LH and FSH. So what happens when you come off of TRT is that you are basically going to go back to the level of hormones that you were before, or potentially slightly lower in most cases. You might be older. If you have been suppressed for a period of time, it may be slightly lower. But really the important thing to remember is if a doctor thinks you're a candidate to try in the first place, you generally have symptoms, you present as a case, and you have supporting blood tests that show that you are low enough. So Mike, what would be the first? I was going to say the two things you can do essentially are just stop, right? Or there are some things that you can work through with a doctor to try and speed up the process of getting your body back to whatever it can produce. So do you want to run through them?
yeah, so you can just stop. There are some patients that have just stopped their TRT, and that's how they've lived. And eventually their levels did return, and there was no need for any sort of other intervention to bring the levels up. But if that doesn't work, because the body will, in most cases, if you produce before, it will come back online. We know this because certain contraceptive programs for men have been introduced where they deliberately suppress your HPTA axis so that you don't produce testosterone on your own or sperm, and you're getting it replaced. And they also added another factor in, like progesterone, to make it even harder for your body to produce testosterone and sperm. And yet, even when they just come off of it without any PCT in these clinical trials, within 6 months, I think 25% of men, get their fertility back, and you can assume that if they get the fertility back, they're also getting the testosterone back. And usually by 2 years, it all comes back to normal. And we've seen this in patients that just stop, will return to a level close to where they started, but that wasn't great in the first place. And the second option is somehow helping the body produce it maybe a bit faster, which may help alleviate certain symptoms whilst you're in those very, very low levels. Because when you just stop your testosterone, It may take a while for the signal in the brain to realize that it's very low on estradiol. That's usually the trigger. And before it releases more gonadotropins, the LH and the FSH. And then there's also the issue if the testes have not had HCG whilst they're on TRT to keep them in shape and accustomed to a certain signal, then they may not be ready to start producing an adequate amount of testosterone when the LH and FSH comes back online. So these would be the ways to do it.
Okay, great. So quick summary: you can just stop TRT, and the testosterone will leave the body, and then eventually the brain will detect that there's not enough of the hormones in your body, so it will actually increase the signal again from the brain to the testicles to tell them to start doing something. And depending on the state of your testicles, I suppose, based on how they were before, generally you're not making enough testosterone before, but depending on what they can produce, they will eventually come back online and produce some testosterone. And then the second option is using something, and it can be some medications that can speed up essentially that process of the brain coming back online and the testicles responding in the way that they can. So that essentially people refer to it in lots of different ways. It can be called a restart protocol. It could be called a boosting protocol. Very similarly from how hormones and steroids have been used. It's a similar pattern in post-cycle therapy. But essentially the aim of it is to, one, stimulate your testicles. So HCG, if it's taken alongside your TRT, stimulates your testicles because it mimics the signal from the brain to the testicles, telling them to do things. So basically, that's how you can maintain fertility on TRT. And then also combining that with something like clomiphene or enclomiphene, if you're in the US and you've got that available, that stimulates the brain. Very basically, it causes the pituitary to produce more LH and FSH again, which is that signal that tells the testicles to do what they should do, which is make sperm and testosterone and get online again. So normally the process would be starting HCG if you aren't on it already before the testosterone you were taking has left the body, just to wake up the testicles if they haven't been stimulated along the way and get them producing some sperm and testosterone. And then what will happen is when that testosterone has left your system, then you generally shortly before that or just after start taking clomiphene. And clomiphene or enclomiphene increase that signal from the brain to the testicles, and then that signal will take over what the HCG was doing, which is telling your testicles to do their job. And a really important thing is that may sound great in terms of, okay, I've switched everything back online, but if your testicles aren't producing testosterone sufficiently to make you feel well, you're not suddenly going to have more than you did before. You're just getting to that point of your body functioning in the way that it can faster.
You have to remember that the end organ, the testes, if they're not efficient at producing testosterone in the first place from any given signal of LH or FSH, then they're not going to get a good outcome, even when their own body stimulated necessarily. Because, let's say they came on TRT and their LH and FSH were 9 and 8, 9, 10 in that range, and yet their testosterone output was only between 8 and 12 or 13 nanomolar per liter. So it took a very strong signal to get a very little bit out. In the early stages, the LH and FSH, when they stopped TRT, might only be a trickle, 1 or 2. So if they couldn't before get a good level of testosterone, with 8 or 9, they'll struggle if they had primary hypergonadism with, even the levels of 1 or 2 shortly after they stop, even with the boosting. So I think primary hypergonadal patients really need to think carefully whether or not it's something that they should come off of, and definitely discuss with their doctor, because it may be more challenging, I think, for those with primary hypergonadism, where if you have secondary hypergonadism, it's just a matter of the signal from the brain kicking back on and stimulating that, which may actually be easier. And then hopefully the testes are sensitive enough to take a small signal and make a larger amount of testosterone for that given signal.
Okay, so that's a summary of essentially how you would come off TRT. well, what we'll do is we'll go through some other videos. We're coming out with some new content. So if you'd like to subscribe, ring the notification bell if you want to hear more of this type of content, that'd be appreciated, and then you'll get notified of it. Other than that, catch us for the next video. So thank you.
Okay, thank you.